Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And this is another one of those videos with a lot of moving pieces and some very important information, so PowerPoint can be a better way to cover these. And this has everything to do with recent study out of the UK. And you've certainly heard me say multiple times that the US data has just sucked around COVID. For whatever reason, much of it's hidden. Any studies that come out are clearly designed to produce an outcome. And if you haven't heard that by now, that there are a lot of people disgruntled with the way our federal agencies have handled things, then I would be surprised, because it's been all over, and a lot of well-known people in the research circles have expressed the same opinion. Luckily, we have other areas around the world, like Qatar, the UK, Israel, Sweden, where we've seen a lot of data and seen sometimes completely opposed data out of the US versus these other countries. And somehow we have human physiology, same virus, same vaccines, and yet somehow we get different outcomes here in the United States. So, not sure how that happens, but it did. So I rarely, if ever, will look at the stuff published by our federal agencies, period. Federal agencies. It's disappointing, but that is the reality. So UK was doing a really good job on reporting, and they used the ONS system, was very transparent, and then they made some changes in December 2021 that made it a little bit more challenging. So this group was able to pull out data from 18 plus from August of 2021 to March of 2022. So a pretty good chunk of the times that vaccines had been available, and about the time where we start seeing any efficacy that was present starting to fail. 22 million cases, so this is a lot of data to wade through. It included 849,000 hospitalizations and 175,000 deaths. So this is a big study with a lot of data. And one of the things they found was that when Omicron hit, it accounted for 51% of the cases, so a little over half of the cases, 28.8% of the hospitalizations, 16.4% of deaths. However, what we started to see was that the CFR is the case fatality rate. So it is the amount of people who die who have been positively diagnosed with COVID or any particular condition. I don't particularly care for CFR because it misses, if only 10% of the people get tested and everybody else is staying at home or doing at-home test kits, you really missed a good marker of how dangerous something is. And that marker is the infection mortality rate. I have always been a much bigger fan of that. Early on, the CFR for COVID was scary because the only people getting tested were the people in the hospitals. So you were already testing a select population that was not going to do well versus everybody who didn't go to the hospital and didn't get tested. So, but CFR, as this situation matured, became a more usable marker. And so basically, early on, up until May 1st, 2022, the CFR was, or starting February 28th to May 1st, 2022, so basically late in the game, the CFR the case fatality rate was 0.41%. The challenge is that the prior 12 weeks, the CFR was 0.19%. So that's almost certainly more than doubling of the CFR for a strain of the virus that arguably should have had a lower CFR, not a higher. So something is happening We have, when you look at that, it's a rough way to look at it, but we've lost a lot of the kindling, the tinder, if you will, the people who had already, who were more susceptible, who had already died off. You had better hospitalizations. We were treating people better. Every reason to think that Omicron should have had much better outcomes and a lower CFR as we progressed, but that was not the case. However, what we start seeing in December 2021, and this is figure 4 of the study, so you really need to kind of look into the study. This has been an issue that people have not been willing to accept, and that is that the vaccination can go negative. So the vaccine efficacy can go negative. There was a lot of concern with this happening after initial and booster doses. Those were seen in the data, but they brushed them off. A lot of people are like, oh, it's the data. It's what it is. People were kind of dancing around it and completely ignoring the fact that there was a negative vaccine efficacy early on. What we're seeing here now is that it really dropped pretty sharply after the third dose, went into the negative, and it flat out dire for the 50 plus. We saw increased cases, hospitalization, and deaths among vaccinated population. Like pretty much everything, the people we wanted to protect were the people that were more vulnerable as a result of getting the vaccination, which is exactly the opposite of what we wanted to happen, right? We wanted to protect the most vulnerable. We saw lower cases, hospitalizations, and deaths among the unvaxxed, and these were rates. So these weren't like, hey, there were less people unvaccinated, more people vaccinated. These were rates. So that argument doesn't apply. And again, the negative. When I say negative vaccine efficacy, it means that these people essentially became magnets for COVID and COVID hospitalizations and COVID deaths. There's certainly discussions as to why that might have happened, which I largely stay away from, even though I certainly have my thoughts. But there is no argument that vaccine efficacy went negative. Why it went negative is certainly up for discussion, but the fact that it went negative is not up for discussion, and yet we're not talking about it. Instead, we're going the opposite direction and pushing for more doses. Pre-existing conditions, not a big surprise, but it played a role in a huge chunk of the deaths. Again, these are the people we want to protect, and it is not happening. And here's what the authors stated: the practice of unadjusted and unvalidated projections of good vaccine efficacy for the hospitalization of the deaths may create a false sense of security and harm the vaccinated population if they do not take adequate precautions to avoid infections. And what that's saying is that we need to be honest with people and let them know that this might not be doing what we think it is. So you run out and get your third dose, and because you're going to be going on a cruise, or because you're going to be going to a party or a friend's house or something, and that may be some of the worst information that we can give people, but by not being honest with them, we are creating a false sense of security and harm the vaccinated population. That is a big concern. That is an absolute critical failure of public health to actually acknowledge this for what it is. So, what's my take-home message? It is what it always is. Given that the vaccine is not the solution we thought it would be, and when I say we, I do not mean those who could read the writing on the wall years ago. We can say years now. Healthy lifestyle changes are the only solid solution, and is the only freaking solution we are not talking about. Gosh, I can't describe how frustrating that is. That we continue to dance around the pink elephant in the room wearing a tutu and ballet slippers. And yet that's what we're doing. We are not talking about healthy lifestyle changes. It can be as simple as getting active, staying out in the sun, and making sure your blood sugar levels are down, and making sure vitamin D levels are what they're supposed to be. It doesn't have to be massive changes. It just needs to be it needs to be out there because the public has not gotten that information that these things make a difference, and they clearly, absolutely make a difference. 2.5 years later, we cannot say that, well, it might not make a difference. They absolutely, positively, without a doubt, make a difference. As always, I'll post a link to this particular study in the description. Make sure you share this video and share it with somebody who you think needs the information, and subscribe to the channel.